Hello everyone. In this video we are going to talk about appendicitis. We need to know what is appendicitis, which is a common diagnosis when people come to the emergency room with right lower quadrant pain, fever, nausea and vomiting. Usually a CT scan is done to detect it. But in this video we are going to understand what is a appendix, the organ in our body, then appendicitis, which is the disease process, and then appendectomy, which is the treatment for appendicitis. So I'm going to draw a colon here, which is our large intestine. It is in our abdomen. Main function of large intestine is to make stool from the residual food left after digestion. And this finger-like projection that you see on the right end of the colon is called appendix. And this appendix is a vestigial organ, which means scientists are debating whether it's useful for the body or not. Some people think it has an immune function. Some people say it has no function. When this finger-like projection gets inflamed, that means swollen because of either something is obstructing the inlet or maybe bacteria has infected it or both. This is called appendicitis. Appendicitis can cause, like I said, right lower abdominal pain. It can cause vomiting and fever, and usually is detected by a CT scan nowadays. But if left untreated, this appendicitis or the appendix organ by itself can perforate. And when it happens, the clock starts, because now death can happen within 8 hours if left untreated. What happens is when it gets perforated, all the stool and the bacteria from the colon is now entering the sterile peritoneal cavity, which is our abdominal cavity from inside, and that causes diffuse infection and inflammation. Treatment for this appendicitis is surgical. That's why I'm drawing a scissor over there. The surgeons would basically cut this appendix out and send it for biopsy to confirm its appendicitis. This surgical procedure is called appendectomy, and that's the definitive treatment for appendicitis. And the hole that is left behind is then stitched by the surgeons so that the colon is sealed again and nothing from the colon is entering the peritoneal or abdominal cavity from inside. If there had been a perforation already during the surgery, they also wash the whole peritoneal cavity, and that is called a peritoneal wash. So this is what appendicitis is, and this is what its treatment, appendectomy, is. Thank you for watching.